name is Jeanette. I'm well into my 50s. In fact, I'm just shy of my 59th birthday. And I'm married to a wonderful man, just coming up for nearly 20 years. The other favourite man in my life is my 12-year-old Wheaten Terrier named Murphy. I'm looking for more of a lift with something that's sort of more substantive and longer lasting. And, particularly concerned just around the sagginess of my skin. So I just like it to be a little bit more generous, uplifted, firm, and just be a better version of me. I actually heard about Ultherapy through a friend and decided to do some investigation of my own. And I was rather intrigued by it. I mean, it's, the things about it is that it's long lasting. And which I like. I mean, I've done a lot of other treatments, which, they'll give you a few months, whereas, Ultherapy is 12 to sort of 18 months. I would never consider cosmetic surgery. I know people that have been through it, and I've seen certainly sort of results, and it's just not something that I'm comfortable with. My expectations for Ultherapy are really to sort of, look to have firmer skin and sort of lift up my skin in certain areas. I'd like to see sort of less lines sort of around my décolletage and my neck. If possible, I'd love to see my forehead lift a little so that my sagginess above my eyes is not as sort of prominent. Just a little more youthfulness and radiance to my skin would be great.
I'm Dr. Gail Nield. I'm a dermatologist, and I founded the Woodbridge Dermatology and Laser Center 30 years ago here in Woodbridge, Ontario. It is a lovely treatment, and it is devised as the only one on the market approved by Health Canada to not only tighten but lift the skin. We're talking about skin in the face, the neck, and the chest region. Well, Ultherapy uses micro-focused ultrasound, and it's delivered to different levels of the skin, so it helps tighten and lift the skin. In particular, the cheeks, the neck, the eyebrows, and even the chest region. It is great to be used along with Xeomin and Bellatero fillers, and it is just a lovely treatment to rejuvenate a man or a woman without much downtime. But on average, I tell patients anywhere from 1 to 2 years, and I have some patients have better results even for 3 years. Actually, for Ultherapy aftercare, there's very little because all the damage was done deeper in the skin. Their outer skin surface is fine. They may have a bruise that they want to cover up after 2 to 24 hours, and there may be a little discomfort, but after that, they really can resume their normal day-to-day activities. Patients do not need to take any time off after Ultherapy. I think most people who feel that they're just looking a bit older, that their skin is droopy, saggy, and they just want to feel better about themselves, but they're not willing to do, say, plastic surgery. With plastic surgery, it actually is pulling up and lifting the skin, but it doesn't actually cause new collagen formation. And so with Ultherapy, it not only tightens and lifts, but you're getting new collagen formation so that your skin just looks more healthy and it's not so thin. And that is a great difference. And I have patients who I've now been performing this procedure for over 10 years, and I have patients who have been coming in on a regular basis, some once a year, some every 2 years, and they look very similar from 10 years ago when we look at their old photos. So I love it because it maintains them and they look natural. They don't look done.
6 months post-treatment, and I'm delighted with the results. I certainly feel my skin has a fresh outlook, feel rejuvenated, certainly a bit of a lift, and finally, my husband's actually acknowledged that he's seen a difference. I had no downtime whatsoever. I went out to dinner that evening, so it just shows you that it's like you walk out of the clinic and you're back. In terms of my skin, I would say that I've seen an overall lift. So more of a natural lift in my skin, smoothness and softening, of lines, particularly around my eyes, sort of around sort of the laugh lines on my face, and certainly jaw. It's probably more defined now than it was before. I love the fact that, thanks to the treatment, that collagen continues to be rebuilt, rejuvenating the skin over time, and so it's continues for a much longer period than you would get from any other treatment. From my standpoint, and based on the benefits that I'm seeing, I would absolutely recommend Ultherapy 100%.
Hello, thank you very much for allowing me to be here today and to share with you my experience with Ultherapy and how to achieve high patient satisfaction and comfort. So first of all, we need to understand the science of ultrasound. So the Ulthera system generates ultrasound waves via a disposable transducer, and this is connected to the handpiece. Each transducer contains two ultrasound elements. One is collimated for visualization of the tissue, and that's shown on the left. And then there's also the focused ultrasound that delivers the actual treatment. So, Ultherapy targets tissues with a more precise and deeper technology than other devices. In particular, there are three features I would like to highlight today. The first is that being temperature. So, Ultherapy reaches a temperature of 60 to 70 degrees centigrade. And we know that this temperature is needed to cause collagen denaturation. And this temperature can be focused deeper down at 4.5 millimeters and also into the dermis anywhere from 1.5 to 3 millimeters. Compared to radiofrequency or lasers, with radiofrequency, it has a suboptimal temperature. It is less than 55 degrees centigrade. And lasers do reach a higher temperature, but it's vaporization only for the top layers. So having an adequate temperature causes incredible new collagen formation. Next, there's the depth. And Ultherapy works on the very deepest layers that cause what we call the foundation of the skin. So at the bottom of the fat pads, the subcutaneous tissue, and just above the muscle is this membranous sheath that we call that's called the SMAS layer. So that's a smooth aponeurotic muscular system. And this is usually targeted when a plastic surgeon wants to do a facelift. This becomes lax over time, causing drooping of the skin, presence of jowls. So this needs to be tightened. And this just becomes more lax over time. And Ultherapy is the only device that can actually get the energy down to where you want, to 4.5 millimeters, where this membrane often lies, and without causing extra heat to the surface of the skin, it will cause tightening and then hence lifting the skin. In terms of depth as well, Ultherapy can also go into the dermis with focused heat, and so it can cause new collagen formation as well. Whereas radiofrequency does not have the depth and it's not so precise, and laser is very superficial. So finally, we call it precision instead of excision. And so you're able to do it very precisely without breaking the skin. And we know that we can look and see exactly where we're targeting the tissue. So this is really, really important to make sure that we're at the right structure to give the right results. So first of all, we need to understand the science of ultrasound a little better. Echogenicity describes how an ultrasound waves are reflected back to the transducer from the skin. The epidermis and dermis are typically hyperechogenic. So the epidermis are lighter in color, and at the very top of the screen there, you'll see from 0 to 1.5 millimeters down. It's sort of white, and it's a band, and this is the epidermis and dermis combined. So they are the first feature that we're looking for when we're doing Ultherapy. Then moving down one layer, and you can see this dark band below it, that's the subcutaneous fat. And within that fat are little white streaks that are little fibrous bands. So the subcutaneous fat is hypoechogenic, and that's why there aren't as many waves bouncing back to the transducer. It appears darker. So it's really important to know your structures in order to do a good Ultherapy treatment. And then finally, you have the fascia, and this is normal fascia. It's collagen rich and it's hyperechogenic. So it appears as a continuous bright linear structure and it's overlying the muscle layer. So this is that foundation that I was talking about that helps give structure to the skin and helps lift it. And that is that target that we want for the very first pass with Ultherapy. So now on to the skeletal muscle. I'd like to, for you to look down at the lower image actually, because in this case, you can see the very top band, that's the dermis and epidermis, that white band. Then you've got the subcutaneous tissue. And then at about 4.5 millimeters, you see that fibrous band. And below that, it says SM is the skeletal muscle. And the skeletal muscle appears as hypoechogenic, so it's a dark band. And this helps us define where we want to get. We want to treat right along that fibrous band, that supporting structure, and it will cause tightening and new collagen formation. And at the very top, once again, we're going to look at a different image. And right away, this looks different. And it shows the beauty of ultrasound. This is a very small, narrow part of the anatomy. So this has to be around the eye, because if you look, the very top layer is the dermis and epidermis, a very faint little area that's a subcutaneous tissue. And right at 1.5 millimeters, that's that fibrous septum that I was talking about, that in the other cases is 4.5 millimeters deep, but in this case, it's only 1.5 millimeters deep. So you would know where to target. And then below that is the muscle. And at 3 millimeters down, that actually is the bone. It's the periosteum. It shows as white. So you know that you cannot use a 4.5 transducer. You would be down into the bone. One, it's painful, and two, it won't do anything but hurt a lot. And then finally, you can see the V, that's for a venule. Look, it's important to notice that these are there. If you do a lot of pulses on a vein, you could get a little bit of bruising, but it's more important to recognize that veins are often accompanied with nerves, and so there can be a little more sensitivity. So you can just move it a little bit and keep pulsing. So I hope you understand that proper ultrasound imaging is essential in providing a customized Ultherapy treatment. Specifically, imaging allows for analyzing appropriate modifications specific to each patient based on the image. You can utilize the ultrasound image to identify target tissue, and you need to recognize factors that can lead to variations in the layers of the tissue. This is like facial area, morphology, body fat content, and pressure applied. In particular, say I was doing the neck region and they had maybe a lot of segmental fat. If I put enough pressure on it, I could then I could look at the transducer and know that I was at the 4.5 millimeter level so that I could actually get to that area, not just zap into the fat. That would not have any work. So what's important here? Well, recently MERS has introduced this Ultherapy See, Plan, and Treat protocol. And this is a novel method of planning and recording a treatment. Our understanding of how to maximize the obtainable benefits of Ultherapy has brought us to this next level of advanced training. And so the three basic components of this advanced treatment method are seen. So from what I've shown you already, you realize how important it is to be able to know what you're looking at with an ultrasound and with the imaging. So by learning how to identify the structures, you will be able to focus your ultrasound properly and get good results. As well, when you're learning, you really do need to practice how to read the ultrasound and also to look at each individual patient and plan out your treatment. And this is a newer feature because it used to be you would look, you would start doing the treatment, but with planning, you can actually put it on a test mode and you can look at the cheek, and maybe the medial cheek, it's 4.5 millimeters to get to that SMAS layer, but maybe lateral cheek, it's only 3 millimeters. So that with that one patient, just doing the cheek, you will be doing different levels. And so you can plan appropriately, have it all written down, so then when you go to treat, you will have better results. So proper patient selection is really, really important. I always take into consideration age of the patient. It used to be, I started doing this, now it's been my 11 years I've been doing Ultherapy. I was looking at some of my old notes and it said, oh no, anyone over 65, forget it. I just had a patient see me this morning before I did this presentation. She's 80. I did her in August and she came back. It's been 5 months. She already was excited because she finds her neck looks longer and she no longer has her jowls. So even at 80, if you're healthy, you can, produce new collagen. So age is not always a limit. We do need to look at skin laxity. If it's very lax skin, sure, you can think of having plastic surgery, but also you can do an Ultherapy treatment and then 3 or 4 months later do a second treatment and get further benefit. Body weight's important. If there's too much subcutaneous tissue, you may not be able to push aside the fat to get to that SMAS layer in order to get tightening and lifting of the face. Medical history is certainly something we always have to check, but I've actually had patients who are on blood thinners. They can have a pacemaker because it's not electronic. I have patients who are undergoing chemotherapy and still with their doctor said, no, they can have the treatment and they get results and they feel better about themselves and maybe their self-esteem and how they feel about themselves makes them feel better and maybe they do better. So I have done all types of patient size, shapes, and ages and gotten good results. One thing you do need to do is ask about prior treatments. I find if they've had a lot of different treatments and they're not happy with any of their prior treatments, this is a red flag that maybe they're not going to be satisfied with this treatment, and it may be just a perception, but you do need to address this. And also, I find good patients are those who are willing to do combination treatments, such as Xeomin and fillers. Ultherapy can do such a great job at tightening and lifting the neck in particular. So if they have very prominent anterior neck bands or lateral platysmal bands, they actually maybe in a few months start to stand out of it because it's pulling up and straining and these become more apparent. So if I can pre-treat with Xeomin, that really makes a difference. And if they haven't done it, then they realize in about 3 or 4 months that we do need to do it for those bands. And some people do want instant results. And so I will then suggest doing some radius along the jawline so they get instant definition so they can continue to see the results over time. So patients really need to have realistic expectations. You need to show the patient numerous before and after photos of Ultherapy patients. And MERS has great portfolios of before and after books that you can use to show patients. And these actually give an authentic, accurate, and truly representative results. So they will see an improvement and ensure this is what they're expecting. So it's really vital prior to doing the Ultherapy so they know where to look. And I find a red flag is if a patient wants to look like she did decades earlier. You're not going to be able to achieve that, nor would you want to. So continue with proper patient selection. Patients, if they're able to delay gratification, they will be good candidates because Ultherapy results do take time to appreciate. Patients, if they're seeking preventative treatments, these are patients starting in their 30s and 40s, and they have a good understanding of being proactive. They're good candidates. And as well, patients seeking further non-surgical, refreshing, anti-aging treatments, they can be in their 50s up to their 80s, and if they're open to maintenance procedures, they could be good candidates. Patients who want to look natural, look good for their age, but not to look done, are also great candidates. And patients who accept that maintenance Ultherapy treatments will provide ongoing benefits are also great because then they're going to want to keep doing it in a few years' time. So I highlight these benefits of Ultherapy. It lifts and tightens the skin without surgery. It boosts collagen production. You have natural looking results. It's no downtime, non-invasive. It's an in-office procedure. It has a very well-established safety profile. Ultherapy has stood the test of time over a decade, and you can get enhanced benefits when combined with Xeomin, Belotero, Radiesse, and proper skincare such as Neoputis. So another feature that I would like to stress today is comfort management. So how do I treat this? First of all, I advise them to have just a light meal so they're comfortable prior to the treatment. And then I have them take 2 extra strength Tylenol, 2 of them, 1 hour prior to the appointment with a lot of water. And so that's 1,000 milligrams of acetaminophen. And then Advil, extra strength, 2 of them, a half hour prior to treatment. So that's 800 milligrams of ibuprofen. And that is all you need. You do not need narcotics. And then after I treat my patients myself, and I prepare them, clean their face, mark out their face, and then I find that having local anesthetic applied to the neck and to the brows are the 2 areas that can really benefit from a little bit of extra comfort control. So I like this one brand, and it's a mixture of lidocaine, 7%, tetracaine, 7%. And after I finish doing 2 passes on their cheeks, their outer eyes, and under their eyes, I will easily peel off this topical anesthetic, do the neck treatment, 2 passes, then I'll peel off the brows and do it. So it becomes very, very easy. The lights should be out. I have like fluorescent lights in my room, and you don't want to be staring into that. And then turn the sound system off the Ultherapy unit. I actually had it for a few years before I realized this annoying sound could be turned off, and it makes a difference. I suggest patients that they can bring in earbuds to listen to music. Probably only about 10% do that. Blankets are available for comfort. Stress ball. I use refrigerated cool ultrasound gel, and I tell patients how long the procedure will take and update them on a regular basis. Now, talk aesthesia is one of my most important tools for ensuring my patient has a pleasant experience. Listen, you need to find a topic that interests them. You need to reassure them that they can talk if they like. It won't interfere with treatment unless you're doing the neck area. They may only wish to listen to me, regaling them with my numerous personal travel adventures. People like to talk about travel, especially now. And in terms of further comfort management, now during the actual treatment, you need to monitor the patient carefully for signs of discomfort during the treatment. They could be grimacing, they could be clutching the stress ball, or their toes are wiggling. You hear sort of crinkling of the paper. So what do? You distract the patient, you put on new gel, and you may even move the transducer a bit to find an area that's a little more pleasant. You can reduce the power intensity, but that's rarely needed. I do it so infrequently. When I go to do it and I'm looking at the monitor, I almost forget where it is. So I do it that infrequently. Remember, your team approach when you're doing this, you need to show that you're aware of what they're going through and where you're going with it, and you care. And they will understand that. So remember, Ultherapy is the gold standard for non-surgical lifting and tightening of the brow, chin, neck, and chest. It is the only technology of its kind that lets you see where you're treating non-invasively. Variations exist in the layers of the skin, depending on the facial area, the individual's morphology, overall body fat content, and external factors such as pressure applied by the clinician. So imaging is an incredibly useful tool to detect variations in the layers of the skin and therefore to optimize treatment. You need to ensure proper patient selection for Ultherapy. You need to set appropriate and realistic expectations. Physician experience is needed for proper technique and the ability to visualize and identify the most appropriate transducers for each patient in each location being treated. And you do need to provide adequate comfort measures so the patient will be delighted to do another Ultherapy in the future. Thank you.